Assalamu alaikum, this is Dr. Hasna, and today I will be talking about the various origins, insertions of muscles and attachments of ligaments, and finally the various joints the scapula forms. Scapula is a complicated flat bone in the body which is placed on the posterolateral aspect of the thoracic cage. There are multiple various types of muscles that are inserted and originating from the scapula. Hence, let's get right into it. Let's begin with the costal surface, which was also known as the subscapular fossa. The name says it. There were three ridges that give origin. From the medial two-thirds of the subscapular fossa comes the muscle called subscapularis. Beneath the subscapularis was another very thick ridge that we talked about, a lever for the overhead abduction. This was the muscle called serratus anterior. Serratus anterior is inserting into the medial border of the costal surface of the scapula via its multiple digitations. One digitation is inserted into the medial border running from the superior angle to the root of the spine. If you see on the back, this is the root of the spine. Two digitations run along the rest of the medial border, and 5 digitations are inserted along the inferior angle or the inferior part of the costal surface. Keep in mind that on the costal surface, there are no attachments of any kind of muscles on the lateral border. The lateral border is empty. Let's move on to the dorsal surface now. In the dorsal surface, as I mentioned earlier, the spinous process was dividing it into a supraspinous fossa and an infraspinous fossa. Since this is a supraspinous fossa, over here there is originating a muscle called the supraspinatus from the medial two-thirds of the supraspinous fossa. And from the medial two-thirds of the infraspinous fossa originates the muscle called infraspinatus. Now we'll talk about the lateral border of the dorsal surface, which is running from the glenoid cavity all the way to the inferior angle, also holds the infraglenoid tubercle. On the lateral border of the dorsal surface of the scapula are two muscles, the teres minor and the teres major. The teres minor basically forms the upper two-thirds of the lateral border, and it is divided into two slips. It is divided into two slips so that a circumflex scapular artery can pass through. And then we have the lower one-third occupied by the teres major muscle. In the medial border of the dorsal surface of the scapula, from the superior angle till the root of the spine, here there is an insertion of a muscle called the levator scapulae muscle. The name says it, it helps in elevation of the scapula, levator scapulae muscle. Then right opposite the root of the spine is a tiny muscle called the rhomboid minor muscle. And below, the entire medial border is accommodated by the rhomboid major muscle. Moving on, we'll talk about the muscles of the crest of the spine. From the crest of the spine, we have an upper lip and a lower lip. The lower lip gives origin to the deltoid muscle. The deltoid muscle originates from the lower lip all the way extending to the lateral border of the acromion. So the deltoid is originating from this entire area. The upper lip and the medial border of the acromion gives insertion to the muscle called trapezius muscle, which I mentioned earlier. Let's talk about the arm muscles. Arm muscles are basically the biceps and the triceps. Now, the tubercles I talked about earlier, these carry significance in that they give the origin to the arm muscles. There are two heads of the biceps head. The long head of the biceps brachii originates from the supraglenoid tubercle, and the short head originates from the tip of the coracoid process. Coracobrachialis also originates from the tip of the coracoid process. The long head of triceps brachii originates from the infraglenoid tubercle. So these were the muscles of the arms. Two more minor muscles that are left is the inferior belly of omohyoid muscle. This is a muscle that runs from the scapula to the hyoid bone, which is lying in front of the trachea. This muscle originates right medial to the suprascapular notch. And there is another small muscle that is inserted into the superior surface of the coracoid process called the pectoralis minor muscle. So these were all the muscles, origins, and insertions. In the next video, I will talk more about the various ligaments and joints that the scapula is forming.